Composite bonding is a really amazing treatment with an increasing number of applications in dentistry. Composite bonding is an amazing cosmetic dental treatment that has revolutionized cosmetic dentistry in the last few years. But we want to give you a full picture so that you can make a decision for yourself about whether it's the right treatment for you. So first of all, the pros of composite bonding. The first and most important thing is that composite, when it's used well, can mimic teeth so well that it is indistinguishable from real tooth structure. What this means is that we can use it for anything from repairing small chips to complete smile makeovers, and it will look just like natural teeth. There's a common misconception that composite bonding looks fake, but this is because either it's not used very well or the dentist or patient have made a decision to choose a really white, fake, opaque looking shade of composite that doesn't look anything like teeth. When it's used well, it looks exactly like teeth. Good composite bonding is always subtle and natural looking. Composite bonding is a very cost-effective solution compared to porcelain veneers. This is because there's no expensive lab procedure involved, because the composite is applied directly to the teeth. This brings the costs down massively, and typically composite bonding will cost around half the cost of a veneer per tooth. The results with composite bonding are immediate. Because there's no lab work involved, the day that you come in for treatment, you'll walk out with your brand new teeth. We usually see you for a review afterwards, just for some fine polishing and to check everything is okay, but the treatment takes place in one single sitting. Another advantage of composite bonding is that it can be adjusted after it's finished. So if, for example, you change your mind about the appearance of the teeth and you decide that actually you want them to be a little bit more square or more round or longer or shorter, it is possible with composite to change the appearance without having to start again. Because composite bonding is such a versatile technique, we can use it for a whole range of cosmetic improvements, including repairing chips and cracks in teeth, masking or camouflaging crowding to make teeth look straighter than they actually are. We can use it to mask and hide discoloration as well. And then we can use it for full veneers and full smile makeovers. So what are the cons of composite bonding? The main thing to know about composite is that it is not as hard as either enamel or porcelain. So this means it will naturally wear faster than natural tooth structure. This is particularly an issue for people who grind or clench their teeth at nighttime, because those teeth tend to be subjected to much more force and much more wear and tear over time. And the composite will just tend to age and wear faster than the natural teeth will. Composite can be prone to staining. There is a misconception that composite itself will actually pick up stains. This is partly because the older composites that we used to use were much more porous and did absorb stains and discolor over time. But the composites that we use these days, when they're highly polished, really don't tend to discolor any faster than teeth. But one thing that does tend to happen is that depending on how the composite has been done and how highly polished it is, sometimes stains will develop around the margins. And in relation to the durability, if the composite is starting to wear and ditch around the margins, those little gaps that start to appear between the composite and the tooth can discolor over time as well. So you should expect with composite bonding that it will require maintenance over a lifetime. It won't be for life once it's done. You need to expect that from time to time it may chip, it may lose its shine and luster and need to be touched up, and it may eventually need to be replaced. So in conclusion, composite bonding is a really amazing treatment with an increasing number of applications in dentistry. These days we use it more and more alongside things like Invisalign and fixed braces, either during treatment to correct things like wear, or at the end when the teeth are nicely aligned but there's been some chipping and wearing over time before the orthodontic treatment. We use the composite bonding as the icing on the cake to get really perfect natural results. We also use it these days for really complex treatments like severe wear of the teeth, which would have traditionally been treated with things like crowns, composite bonding can be used instead as something that is much less invasive and gives even better results than what would have been possible in the past. So if you think that composite bonding might be for you, then come and see us for a consultation. We will look at what changes you want to make and what might be possible with composite bonding, but also discuss any alternatives with you so that you can make a fully informed decision about whether it's the right choice for you.